I'm involved in the aviation industry. I'm an aviation maintenance technician, and I was at work back on March 3rd of this year. And I had to do a little bit of maintenance around the hangar, and I was disassembling a kind of an industrial shelf, and the shelf came down and lacerated my right thumb. Once it was lacerated, I had no movement of my thumb at all. I went over to the emergency room. It was late in the evening, just stitched me up and recommended that I call Dr. Shah the first thing in the morning, which I did.
So Bill, who is a wonderful patient of mine, hardworking and very dedicated patient, was actually sent to me from the emergency department in follow-up because he had a laceration to his thumb that was concerning to have a tendon injury. Oftentimes a hand specialist or a plastic and reconstructive specialist with some specialty hand surgery training like myself will get involved in the patient's care, because if there is concern for a tendon injury, it's something that has to be addressed very quickly and also very carefully in order to reconstruct and restore the patient's function that they may have lost. Bill, for example, was at work, suffered a bad laceration to his thumb, and the laceration also involved the tendon that is responsible for moving his thumb down. If that tendon injury is not addressed within about 1 week, so 5 to 7 days or so, the ability to reconstruct that tendon is lost, and the patient may never regain the functionality of the thumb, which brings the thumb down. As most people know, the thumb is the most critical digit in the entirety of the hand, so we wanted to address Bill's condition very quickly.
Dr. Shah made me extremely comfortable with the whole idea. He said I wouldn't feel a thing. He would be explaining the procedure as he was going through it, which he did like an outstanding job. I mean, he literally, anytime he was doing something to my hand, he was telling me exactly what he was going to do. And I was pretty much numb from my elbow down. In stages he did that prior to, actually doing the procedure. And yeah, I didn't feel a thing. And once he reattached the tendon, he had me move it, which I couldn't feel, but I was watching it, and which was pretty amazing. And yeah, he said everything looked good. There was no impingements, and yeah, it was great.
A little more. Good. Okay, great. Now you can sort of relax the thumb.
So Bill and I made a plan together. He was an amazing patient, someone who worked very hard and was going to be working very hard with our post-operative care regimen. And we made a plan for him to do a wide awake tendon reconstruction so that we had the opportunity to explore the injury that he had in this region here, check to see if there was a tendon injury, and then perform a repair while he was awake. The reasoning being that if we can test a tendon repair in the operating room after we perform the repair, it gives us a better post-operative outcome. So Bill and I developed this plan together. He underwent surgery. He was the best patient that you could hope for in the post-operative setting and did everything that was required of him to get the tendon to work very functional and very strongly under the guidance of his hand therapist, Alta Fried. And he had what we found to be a pretty exceptional outcome, which we were very excited by.
He recommended an occupational therapist to me, who he said he had complete trust in doing what he and she thought would be the best route for me to have a full recovery. I had surgery on a Monday, so I believe it was later in the week when I saw her the first time. And she was, again, outstanding. And yeah, I did everything that he had asked me to do, and I did everything that she had asked me to do. I went to OT, occupational therapy, 3 times a week, sometimes 2, but pretty much 3 times a week for 12 weeks. The day after week 12, I played golf. So I worked hard at it, and I'm extremely pleased. I mean, I don't have any restrictions at work. I'm able to do everything that I did before. And like I said, my job, I work with my hands every day. So that was, it's extremely important to me that I did have a full recovery. And I think that having the surgery while I was awake was, a big part of me having a full recovery.